Hello, dear students. Let's continue with our online teaching. So today we are going to study about pleura. What is a pleura? Pleura means a membrane lining the thorax and enveloping the lungs. Here are the two lungs, right and left lungs, and this membrane is known as pleura. Actually, the pleura and the lungs, they lie on either side of the mediastinum within the chest cavity. Mediastinum is a new term for you. Mediastinum means a middle space in between the lungs. The various organs present in this area are like heart, the large vessels, esophagus, bronchi, lymph nodes. So mediastinum is a very important space. Mediastinum is divided into two parts, superior and inferior. Inferior mediastinum is further subdivided into anterior, middle and posterior mediastinum. So let's have a look. What is a mediastinum? This is the middle space in the thoracic region, and it is divided into superior part and the inferior part. The inferior part is further subdivided into anterior, middle and posterior. The contents of the superior mediastinum are trachea, esophagus, brachiocephalic artery, veins, the various nerves like vagus nerves, phrenic nerves, and there is a duct known as thoracic duct. While in the case of inferior mediastinum, the main important part is the middle mediastinum. Here we have heart, which is enclosed in its own covering, and that is known as pericardium. Pericardium. And the other structures which are present here are arteries like aorta, pulmonary trunk, veins like superior vena cava. So we'll have a separate lecture for the mediastinum just to give you a brief introduction. What is a mediastinum? Now we come to pleura. Pleura is lined by mesothelium. Mesothelium means that it is derived from embryonic mesoderm. Mesoderm, we all are aware of this term. Each pleura has two parts. Each pleura has two parts, parietal layer and a visceral layer. Before that, I just want to add one more thing about mesothelium. It provides a slippery, non-adhesive and protective surface for lungs. Mesothelium. Now yes, pleura is further subdivided into two parts, parietal pleura and a visceral layer. Parietal and visceral layer. So if we see the lungs, this is the trachea, the coverings of the lungs. This is the parietal pleura, which is the outer layer, and here is the visceral layer or visceral pleura. Now we talk about parietal pleura. Now parietal pleura, it lines the thoracic wall. It covers the thoracic surface of the diaphragm as well as the lateral aspect of the mediastinum. Parietal pleura, it lines the thoracic wall and is subdivided into four parts: costal, cervical, diaphragmatic and mediastinal. So these are the four parts of the parietal pleura, and we are going to study one by one. Let's have a look about the various parts of the pleura. This is the cervical pleura, costal pleura, mediastinal pleura and diaphragmatic pleura. Diaphragmatic pleura over here. This diaphragmatic pleura. What about the cervical pleura? Cervical pleura means it is related to cervical region. That is, it extends up to into the neck, and it lines the under surface of the membrane. This membrane is also known as Simpson's fascia or suprapleural membrane. The cervical pleura, it covers the apex of the lungs and reaches a level of about 2.5 to 4 centimeters above the medial third of the clavicle. So we can see over here, this is the lung, its apex, and here lies the cervical pleura. Above the cervical pleura, there is one more layer which is known as suprapleural membrane or Simpson's fascia. You can see the transverse process of C7 vertebra over here. So here lies the Simpson's fascia or the suprapleural membrane till the first rib. Next is the costal pleura. Costal pleura, it lines the inner surfaces of the ribs, the costal cartilages, the intercostal spaces, the sides of the vertebral bodies, the back of the sternum. So these are the areas, and costal pleura is loosely attached by a layer of areolar tissue, and this areolar tissue is known as endothoracic fascia. Endothoracic fascia. You can see the lungs over here. This is the costal pleura. It is attached to the structures we mentioned earlier. And you can see the diaphragm. So the pleura which is related to the diaphragm, here it is known as the diaphragmatic pleura. So what is diaphragmatic pleura? We can study the detail now. It covers the thoracic surface of the diaphragm. The thoracic surface of the diaphragm. In quiet respiration, the costal as well as the diaphragmatic pleurae, they are close together. They are in opposition to each other below the lower border of the lung. They are close together. But in the case of deep inspiration, these pleurae, that is the costal as well as diaphragmatic pleurae, they separate. See over here, here lies the diaphragmatic pleurae, here is the costal pleurae. They are in close opposition, they are close together. But in the case of deep inspiration, when the lungs expand, they separate. Now is the mediastinal pleura. What about the mediastinal pleura? It covers and forms the lateral boundary of the mediastinum, and it is reflected as a cuff around the vessels. Cuff, you know, it is reflected as a cuff around the vessels and bronchi at the hilum of the lung. Hilum means it is the region of the lung where the bronchi, arteries, veins, nerves, they enter and exit the lung. And then this mediastinal pleura becomes continuous with the visceral pleura. We'll study now visceral pleura also. So it is attached to the blood vessels and bronchi that constitute the lung root. So if we just want just talk about the mediastinal pleura, it is where it is. It is in relation with the mediastinum. It forms the lateral boundary of the mediastinum. This slide is showing you the various parts of pleura: the cervical pleura, the costal pleura, the diaphragmatic pleura, and here lies the mediastinal pleura. The 4 types of the parietal pleura. And when we remove this parietal pleura, here we can see the visceral pleura. So what is visceral layer? This layer, visceral layer, it completely covers the outer surfaces of the lungs. It extends into the depths of the interlobar fissures. The lungs have various lobes which are divided by various fissures. So this visceral layer extends into the depths also of this interlobar fissures. Visceral layer does not cover hilum and at the attachment of the pulmonary ligament. It is continuous with the parietal pleura. This means this diagram is showing you the parietal pleura as well as the visceral pleura. The visceral pleura, the inside one. So you can see it is extending into the interlobar fissures, the visceral pleura. Okay, you can see. So this is the visceral pleura. And it becomes continuous with the parietal pleura. The parietal pleura is over here, the outer layer. We have used the term pleural cuff. What do you mean by that? These two layers, pleural cuff, what is this pleural cuff? These two layers, they are continuous with one another by means of a cuff of pleura. And this cuff, it surrounds the structures which enter or leave the lung at the hilum of each lung. Cuff is a simple cuff, you understand. Pleural cuff, it hangs down as a loose fold, and this loose fold is known as the pulmonary ligament. This pulmonary ligament is the hanging part, and it contains loose areolar tissue with few lymphatics. And the main function is it is a dead space for pulmonary veins expansion. Fine, it provides a dead space, a space for pulmonary veins expansion. This is the lung we are going to see over here, and this is the hilum. This is the left lung, I would say. So this is the hilum, and here lies the pulmonary ligament. Very nicely seen. If we just take out the hilum, and here lies the pulmonary ligament. Just concentrate on the pulmonary ligament. The loose areolar tissue is present in between and few lymph nodes. Now we will study about pleural cavity. What is the pleural cavity? The two layers, the parietal layer and the visceral layers, they are separated from one another by a slit-like space, a very small space, and that is known as the pleural cavity. Now clinicians use the term pleural space instead of the anatomic term, that is pleural cavity. It contains a fluid, that is a thin film of tissue fluid, and that is known as the pleural fluid. Pleural fluid. This fluid permits the two layers to move on each other with the minimum of friction. So it is non-adhesive. It provides a slippery surface. The fluid. These are the two lungs. Here lies the pleural cavity. In between this cavity we have the pleural fluid. The fluid is in between this thing. Then we'll study about the recesses of pleura. Recesses of pleura. These are the spaces of pleura. What happens? During full inspiration, the lungs expand and they fill this pleural cavities. But in quiet inspiration, during quiet inspiration, the lungs do not fully occupy the pleural cavities. And there are four sites for these recesses. These are right and left costodiaphragmatic recesses of both the sides, and right and left costomediastinal recesses. The costodiaphragmatic recess, let's study what it is. The name itself is telling you it is a space between the costal and the diaphragmatic parietal pleurae. Costal and diaphragmatic parietal pleurae, it is that space, and extends from 8 to 10 ribs. It is separated only by a capillary layer of pleural fluid, a very thin layer of pleural fluid. During inspiration, what happens? The lower margins of the lungs descend into the recesses. And during expiration, the lower margins of the lungs ascend so that the costal and diaphragmatic pleurae come together again. I repeat once again. Costodiaphragmatic recess is a recess, a space, a slit-like space between the costal and diaphragmatic parietal pleurae. Okay, extends from 8 to 10 ribs. In between, we have just a capillary layer of pleural fluid. During inspiration, what happens? The space is there, the lung has to descend into this recess. And during expiration, the lungs has to ascend so that these two layers, they come close together again. They are in apposition with each other again. I hope this is clear to you. So here lies the costodiaphragmatic recess of both the sides, right and left sides. Costodiaphragmatic, diaphragm is over here, the costodiaphragmatic recess. Then is the costomediastinal recess. Since there are two, so we have recesses. So they are situated along the anterior margin of the pleura. It is separated by a capillary layer of pleural fluid. It lies behind the sternum and the costal cartilages. Costomediastinal recess. During inspiration and expiration, what happens? The anterior borders of the lungs, they slide in and out of the recesses. The lungs slide in and out of the recesses. So if we can see over here, this is the costodiaphragmatic recess. In this slide, we have also shown you two lines, the mid-clavicular lines and the mid-axillary lines. Let's see once again. This is the costodiaphragmatic recess, and interior lies the costomediastinal recess. Then we come to the blood supply of pleura. The parietal pleura first. The parietal pleura receives blood supply, the arterial supply from the arteries, which are intercostal arteries, internal thoracic arteries, and the musculophrenic arteries. The venous drainage is into the azygous and the internal thoracic veins. Lymphatic drainage is into the intercostal, internal mammary, posterior mediastinal, and diaphragmatic nodes. In the case of pulmonary pleura or the visceral pleura, so this pulmonary pleura means it is related with the lungs itself. So the blood supply is the same as that of the lungs. The venous drainage is again the same as that of the lungs, and also the lymphatic drainage is same as that of the drainage of the lungs. Like arteries is the bronchial arteries, veins, venous drainage is into the bronchial veins, and lymphatic drainage is into the bronchopulmonary lymph nodes. So this slide is showing you the blood supply of the pleura. The parietal pleura is into the intercostal, internal thoracic, musculophrenic vessels, and visceral pleura is by the bronchial vessels. Then comes the nerve supply of the pleura. The parietal pleura is sensitive to pain. Parietal pleura is sensitive to pain, temperature, touch, pressure, and it is supplied by as follows. The costal pleura is supplied by the intercostal nerves. Intercostal nerves. The mediastinal pleura is supplied by the phrenic nerve. By the phrenic nerve. This phrenic nerve also supplies the diaphragm. The diaphragmatic pleura is supplied over the domes of the lungs by the phrenic nerve. Domes of the um, diaphragm, phrenic nerve, and around the periphery by the lower 6 intercostal nerves. So, diaphragmatic pleura is supplied by two types of nerves, around the periphery by the lower six intercostal nerves, and over the domes by the phrenic nerve. So you can see over here the parietal pleura key innervation. It is sensitive to pain, temperature, and touch, and it is supplied by the intercostal nerves, the phrenic nerve, as we just discussed. Now the visceral pleura, the nerve supply is different. The visceral pleura, which covers the lungs, is sensitive to stretch, anoxia. It is not sensitive to the common sensations like pain and touch. It is sensitive only to stretch and anoxia. The nervous supply is now here is autonomic by the pulmonary plexus. The sympathetic nerve supply is by the 2nd to 5th spinal segments, and parasympathetic is from the vagus nerve. Vagus nerve. Finally, we come to the applied. There is one procedure known as paracentesis thoracis, that is aspiration of fluid from pleural cavity, and this is done in 8th intercostal space at the mid-axillary line. This pleural fluid, it normally contains about 5 to 10 ml of pleural fluid, and it lubricates the opposing surfaces of the two types of pleura, visceral as well as parietal, during respiration. The formation of this fluid results from hydrostatic as well as osmotic pressures between the capillaries, and it is then further normally absorbed into the capillaries of the visceral pleura. But sometimes there are certain conditions when there is increase in the production of fluid or drainage is impaired, and it results in abnormal accumulation, and this condition is known as pleural effusion. Pleural effusion. When there is presence of about 300 ml of fluid in the costodiaphragmatic recess in an adult, it is sufficient to enable its clinical detection. And the clinical detection, the clinical signs include there is decreased lung expansion on the side of the effusion. So the breath sounds would be decreased, and when we percuss, there would be dullness on percussion over the effusion. So see in this slide, the right lung is collapsed, and here is the accumulation of the fluid. This is pleural effusion, and the breath sounds would be absent. You can see one more slide in which there is accumulation of the fluid, that is a pleural effusion. So how do we drain it? The patient is sitting, and we have to collect the fluid in the bag or syringe, and we've studied that it is drained in which space? In the mid-axillary line. Yes, we studied. It is done in 8th intercostal space at the mid-axillary line. So you can see over here, the patient is sitting, and we insert the needle, and we just collect the fluid in a bag or syringe, whatever. This is a chest X-ray showing you the pleural effusion. There is one more term that is known as pleurisy. What is pleurisy? It is the inflammation of the pleura. That occurs due to conditions like, say, pneumonia. What happens? The pleural surfaces, they become coated with inflammatory exudate, and the surface becomes rough. When there is roughness, there will be increased friction, and the pleural rub can be heard with the help of stethoscope, of course, during inspiration as well as expiration. So there is inflammation normally seen in, pleurisy is seen in conditions like pneumonia. This exudate, if we see the pathology, The exudate is invaded by fibroblasts, which lay down the collagen, and it results in binding of the visceral pleura to the parietal pleura, and adhesions are formed. There are certain terms you should know, like pneumothorax. Pneumothorax means presence of air in pleural cavity. Hydropneumothorax means presence of fluid as well as air. Hemothorax means presence of blood. Hemo, presence of blood in the pleural cavity. Empyema means presence of pus in the pleural cavity. So when there is accumulation of blood, that is known as hemothorax. When there is accumulation of pus after the formation of the lung abscess, so it results in the formation of pus in which is present in the pleural space, and that is also known as empyema thoracis. Empyema thoracis. Thank you so much for your patience. Have a nice day.